Hello everyone. I'm excited to update all of you on a new survey tool the Center for Physician Wellbeing is going to introduce this week to help us better support provider well-being and career fulfillment. The success of any well-being program is dependent on obtaining relevant, timely, and actionable feedback from our frontline providers so that we can continue to support physician well-being and the exceptional practice experience. Historically, we've used a variety of surveys which unfortunately were not specifically designed to measure provider well-being or career fulfillment. Although well-intentioned, they didn't allow us to prospectively identify specific pain points or measure the impact of our interventions. We've also had no way to track our outcomes or benchmark with other healthcare organizations. After reviewing several options, we've landed on the Mayo Clinic Physician Wellbeing Index. This survey was developed by Dr. Tate Shanafelt and Dr. Liz Derby, who are both internationally recognized thought leaders on physician well-being. The rationale for picking this particular survey involved the fact that it was confidential, completely anonymous, and you can use your own personal email and your own customized password. It's important to recognize that this is a screening tool and it's not a diagnostic tool. It can be easily accessed on your mobile device, and it's been widely used by over 600 healthcare organizations globally, including over 125,000 responses. It's been extensively validated by research, and it only involves 9 simple questions that can be generally completed in less than 2 or 3 minutes. It will also provide us ongoing ability to track and benchmark our results. It also gives us the ability to add customized questions to meet the unique needs of our providers. It provides all of our providers a dashboard for comparing their well-being to their peers. It's also designed to help us proactively reduce burnout and the significant impact that it has on providers' personal and professional lives by linking a provider's individual responses to educational and supportive resources unique to that individual's needs. So what does the survey measure? It looks at 6 dimensions of distress: meaning in work, severe fatigue, work-life integration, the likelihood of burnout, quality of life, and suicidal ideation. How one scores on this survey also is a fairly strong predictor of the risk of medical error. At this time, I'd like to share with you a brief video from Dr. Shanafelt that will walk us through the registration process and provide a brief tour of the provider dashboard.
Hello. Thank you for your interest in the Physician Wellbeing Index. This interactive online tool will allow you to calibrate your well-being relative to physicians nationally and provide immediate access to a wide range of free resources, most of which are online. Once you click on the link, you will be invited to set up an anonymous account. You will then be asked to answer the 7 yes/no questions of the well-validated Physician Wellbeing Index. As soon as you complete these, you will be provided a screen that looks like this, giving you objective feedback regarding how your well-being in a variety of dimensions compares to physicians nationally. After reviewing this data, click on the Resources button. The Resources screen provides information on a variety of topics important for physician health. Click on the topics that interest you. Each resource tab has a brief video outlining what is known about the physician's experience in this domain. It also includes a list of local resources related to this topic provided by your medical center, as well as online national resources and a link to key scientific publications on this topic. To set up an account, you will be required to enter an email address along with a password of your choosing. Please note that all the information entered is anonymous. It is housed on secure encrypted servers and is not available to your medical center or the medical society that invited you to use this resource. Please also note that you can use any email address you choose. You do not need to use your work email. Additional security information can be found under the privacy policy link on the website. This tool also allows you to track your well-being over time. When you set up an account, you will be asked how often you wish to be sent a reminder inviting you to reassess your well-being, with options of quarterly, semi-annually, or once per year. Thank you again for your interest in the Physician Wellbeing Index. We hope this tool will provide you useful information on how your experience compares to physicians nationally, allow you to track changes in your experience over time, and link you to useful resources to help you promote your own wellness.
This week, all CPN providers on Thursday, January 14th, will receive an email from the center with instructions on how to register. If you have any additional questions about the survey or have any difficulty registering, please reach out to one of us at the center for help. In closing, 2020 has been an incredibly difficult year for all of us. COVID-19 has stressed an already struggling provider workforce. All of you, our staff, and our executive leadership team have worked tirelessly to care for our community. Over the last few months, most of our network focus has been on crisis communication. Moving forward, efforts promoting resiliency will require more critical listening as well. This survey tool will help us better listen to you and understand your needs and concerns. 2021 brings us new hope. We now have COVID-19 vaccines, we have better understanding on how to manage COVID-19 patients, and we've also developed better procedures and policies, resources, and protective equipment, which are certainly helping. But we know challenges will persist. Moving forward, we really need everyone to take just a few minutes as part of our professional responsibility to utilize this survey as an exercise in self-care. There's never been a time when self-compassion has been more important. As providers, we are traditionally very hard on ourselves. We need to continue to normalize and acknowledge the need for mental health support. Just as COVID-19 vaccines are designed to protect us from physical illness, practicing self-awareness of our emotional needs provides us a psychological immunization to help sustain us during these difficult times. So please, take 2 minutes to check in with yourself, as well as provide us the feedback we need to help support you. Thank you, and wishing you a happy and safe New Year.